Hi, my name is Kelsey. I'm a dietetic intern and I'm here to talk to you about hypertension today. So, hypertension is a medical term, a fancy word for saying high blood pressure. And this means that your blood is pushing too hard against your artery walls. And this can happen for a variety of reasons. It could be that your blood vessels are too stiff or narrow in your blood, or your blood is holding on to too much fluid, or your heart is pumping too forcefully. And this can happen for, again, a variety of reasons. It could be a chronic inflammatory response, could be kidney issues, it could be plaque buildup in your blood vessels, or a hormone imbalance, to name a few. The plaque buildup on your blood vessels is a really common problem. And I have this little picture here that I can show you to kind of explains what happens. So as you can see, there's this little road and it signifies or symbolizes your blood vessels. And we have cholesterol here. Now there's two kinds of cholesterol. There's LDL cholesterol, which is sometimes considered like the bad cholesterol, and HDL cholesterol, which is considered like the good cholesterol. And in this little picture here, the yellow guys are the LDL cholesterol and these little cowboys are the HDL cholesterol. And we can get LDL cholesterol sometimes from your liver and also from your diet. And as you can see, this is a diet high in saturated fats, which we'll talk about a little bit in a second. But as our blood pushes these guys through, as you can see, if we have a diet high in LDL cholesterol, it can sometimes cause like a blockage or a buildup of these LDL cholesterol guys, and it can kind of make it hard for our blood cells to move easily through the road or the blood vessels. And that's what happens with hypertension is if there's lots of plaque buildup, it can narrow the walls of the arteries, blood vessels, and it can also make them less elastic, so it's harder for your body to regulate the blood pressure. So it can cause problems. Too much blood pressure puts pressure on your organs. It puts like chronic inflammation throughout your body. So these little HDL guys their job is to clean up the LDL cholesterol. So they're really important, and we can talk about what we can do through our diet and nutrition to prevent or cure hypertension. And there's specifically a diet for it. It's called the DASH diet. It's an evidence-based diet recommended for patients with hypertension, and it stands for Dietary Approaches to Stop Hypertension. So some key points of the DASH diet include eating fiber found in fruits, vegetables, and whole grains. Fiber is kind of this magical nutrient that can actually help lower the amount of that LDL cholesterol that's in your arteries. So it's super important to get lots of fruits and vegetables in our diets, and they also have cardioprotective nutrients like antioxidants that kind of help us to avoid chronic inflammation, which can also cause and lead to hypertension. Eating healthy fats like unsaturated fats, which come from like olive oil, soybean oil, canola oil, and omega-3 fatty acids that are in salmon, flaxseed, walnuts, they can help reduce your risk of heart disease and stroke. There are a few foods that you want and nutrients that you want to limit and be aware of. One of them is salt. So salt can pull more fluid into your blood vessels, and that can cause that hypertension to get even worse, that blood pressure to go up. So strive to eat foods with less than 300 milligrams of sodium per serving. And then consuming foods that are low in saturated fat. That can also help to prevent that buildup of those LDL cholesterol, and if you follow these little guidelines, then we can help prevent further disease from hypertension and even get it to go away. So I hope that you found this helpful.